First of all, my background is pretty eclectic. I practiced cardiology for 35 years, both in the ivory tower and in the lovely community setting of Cape Cod. And I've held positions with many different vantage points in the system. I did animal research in a lab at Harvard. I co-founded a medical device company, raised money in Silicon Valley, and started first for that company corporate research around the country in academic medical centers. I founded a primary care network that took global risk, upside and downside, successful group, and with that, learned how to negotiate with health plans, hospitals, specialists, and you name it, as well as getting my colleagues to figure out how to operate on a fixed budget. And these days at the Lown Institute, where I am now, our task is to develop bold ideas for the kind of healthcare system that everyone in the United States says they want, which is one that is effective, affordable, and just. So we're going to be talking a little bit about the causes and solutions of medical debt. We'll be doing it all day. But I think we have to acknowledge that medical debt is a symptom. So you can take an aspirin, Tylenol for your fever. That doesn't make it go away. The symptom is of the deeper affordability crisis in the country. So any permanent solution, if we aspire to permanent solutions, have to look at the underlying drivers of high costs. And there's no mystery about what those are. And I think everybody in this room could probably name them. So let me just do that in no particular order. Consolidation and monopolies, relentless technological innovation, some of which is near miraculous, but too much of which is capital intensive and a waste of time. Wasteful administrative costs that from a ridiculously complex insurance system. Then there's Baumol's disease, the Princeton economist William Baumol, which is the tendency of service sector costs to rise relative to manufacturing costs. The increasing prevalence of chronic disease, which is getting its day in the sun with Bobby Kennedy, with mixed results in my view. An aging population, and maybe there's a fix for that. And then something the Lown Institute highlights every year with our annual Shkreli Awards, and something we shouldn't be afraid to say out loud: a growing culture of greed, grift, and rent seeking. So obviously we're not going to get to all this today, but we should remember these things because otherwise we're going to be condemned to a perpetual game of whack-a-mole. Every time we try, we'll fall short. So finally, let me just say that medical debt is not a Democrat issue. It's not a Republican issue. It's an American issue. When we're healthy, we, the living, forget our mortality. But when illness shatters that illusion, the kind of anxiety it triggers, whether you're aware of it or not, that anxiety is not the time to be worrying about money. So for the wealthiest society in history to impose financial fear on the sick, to me, is just grotesque. A nation whose people are forced to choose between medical treatment or food, housing, or heating cannot call itself a great nation. So let me just say that neoliberalism's answer to all this, copays and deductibles, is a failure. In over 35 years of practice, I've seen almost no one come in for care just for kicks. Charging $35 a visit to someone making $15,650, you can look that one up, that is not going to fix the system. So let's be serious. As my friend Rashika Fernandopoulos once said at a Lown conference many years ago, patients already have skin in the game, their actual skin. So if you look at the various crosstabs of the KFF surveys, which I did preparing for this talk, I actually was flabbergasted. Working on this issue for a year, looked at some of these numbers, I found them hard to believe. So I hope the methodologies are good. But here's one: 44% of insured working age adults had experience with some form of medical debt, current or otherwise. That means out of roughly 217 million working Americans under the age of 65, over the age of 18, something like 95 million are in that group, and that does not include seniors. And here's one thing that's easy to forget because medical debt is usually reported as a rate in various populations. The rates are higher in people with lower incomes. They're higher in younger people. They're higher in Blacks and Hispanics and in women. Not exactly a surprise. But make no mistake about where the largest numbers of people with medical debt are. With the KFF numbers, I calculated that anywhere between 90 and 130 million, I don't know, 90 to 130 million out of a total population of 255 million white folks in America have now or in recent years experienced some form of medical debt. That is to say, medical debt is a key problem in the lives of non-college educated white working class people, particularly women. Need I point out that Donald Trump won that constituency by 28 points? I think Senator Josh Hawley seems to know that, given what he's been saying lately. So we're all here because this issue really is a moral stain on the fabric of the country. We're here because too many of our friends and neighbors, our brothers and sisters, our parents, our children, too many of them are grappling with a difficult, sometimes intolerable situation. So if we're going to be declaring national emergencies, maybe this is one. But we're also here because if we want to fix this, we can.